The sun is setting. I wanted to make a little intro to this video. Uh, it is it is what it is, and it's a little bit lengthy. I ramble on, but hopefully you can maybe even just listen to it in the background if you want, maybe sometime when you're driving. Um, and I hope you enjoy it. I had fun making it. Hey there, folks. So I want to tell some stories today. Um, this past week has been a very eventful week. Events, and some of you know, if you it's chilly out here. Pull up a hood, block the wind on the back of my head. I think it's about 45 degrees. So yeah, this week has been eventful with an event, and you have to stay tuned because I'm a little bit of a long-winded storyteller at times, and this might be one of them. So let me really quickly review some things. Last year I walked 1,135 miles, and I have been working towards, I have goals in the future. I'd like to, in March, possibly April, go on a 77-mile backpacking trip. It'll take 6 or 7 days on the Foothills Trail. And I also have it in the back of my mind that I'm working towards training for an Appalachian Trail attempt in 2024, which is, depending on the mileage that year, 2,100 miles over 5 to 6 months. So I have goals. Last week, 1 week ago today, I drove up to Sky Meadows State Park for a 2-night camping hiking trip. It's a backcountry campsite, so full pack loaded, walking only about 1.5 miles from the car where you park to the campsite. And what was special about that weekend was I knew it was going to be really cold. Sunday morning it was 23 degrees. On that weekend, one day I did 5 miles of hiking, and it was pretty hilly. So I went on this little 2-night trip alone, survived, had a great time. I had a 1-mile stretch of hiking where in 1 mile I had about maybe an 800-foot gain of altitude, which for me is an unusually steep grade, and it was very challenging, and I survived just fine. Came back home, did my trip, worked on Tuesday. I decided that Wednesday I would go over to Norfolk, go to the office, and sign some papers. I made it to the office just fine, signed some papers. And my next stop was Mount Trashmore in Virginia Beach, where my goal was I was going to walk about 2 miles up and down the hills of Mount Trashmore. That's a pretty steep grade, and it wears me out when I do that. But again, that was part of my training. I need, in my mind, to achieve the goals that I want to achieve, I need to get in shape. Got out of the car, walked about 100 yards on flat ground, and I was noticing that I was having chest pain. And it was the kind of chest pain that really grabbed my attention. And it wasn't indigestion, it didn't feel anything like that. It was worrying me. And as I approached the bottom of the hill at Mount Trashmore, I realized, no, I actually need to not walk up and down hills, and I need to turn around and go back to the car and seriously consider going to a hospital. I mean, that's the kind of chest pain that it was. So I went back to the car and sat there and noticed that the pain was easing. Along this time, I'm also spinning scenarios. What should I do? Should I call 911? And I kept pushing that down. No. I knew where the nearest hospitals were. Should I go there? And I decided that no, I wouldn't go to one of the nearest hospitals because that's not where I would want to be if I needed a cardiac cath and some stents. So I was already thinking ahead that this was that serious. But I also always interject some denial and some other stories into that dialogue when I contemplate something serious for myself. If anyone had called me and said, "Hey doc, this is what's happening. What should I do?" Get off this call. Call 911. They'll take care of you. They'll take you to a hospital. They'll check you out. If they have to, they'll save your life. That's standard advice. And if I had called anybody, they would have told me to do that. But that's not my brain for me. Anyway, so the pain went away. I used good judgment to decide that it would be okay to stop by REI because I had plans on being away this weekend at another place. Wanted to pick up a few things, so I went into REI. Very little discomfort. Got my few things, then I decided it's still there. I think I should probably go to a hospital, and I decided that I needed to be at Norfolk General where they have the heart hospital. The cath lab is there. They can do bypass, they can do cardiothoracic surgery of any flavor that you might need. So I figured that's where I want to be. So I decided to stop at the grocery store that I like first. Might as well buy some aspirin, take an aspirin because I didn't have any in the car. And that pain was there again from walking from the car into the grocery store. Went back to the car. I called Karen and told her, I'm going to need to go to the hospital. I'm going to go to Norfolk General. I'm going to drive myself and get checked out. And of course, Karen was appropriately worried. I don't think she told me, "Listen, you knucklehead, stop what you're doing and call 911. So off I go. Norfolk General is about 20 minutes away. Parked the car, walked in, and started my adventure in the hospital. The ER was full, smelled like weed. Seriously, I looked around to see who was smoking weed in the ER. One line of registration. There were about 4 people in front of me. I get up to the window. I told the nice lady that I was having chest pain. I'm having intermittent chest pain that is pretty serious, and I'm very concerned. So she puts an armband on me. Actually, I still have it on. She said, stand over here and somebody will take you back to get an EKG. That's the way it was. Get the EKG. I was real happy. I looked at it myself and I was relieved that there weren't signs of severe muscle damage in the heart. It looked like a very normal EKG. But that doesn't mean that everything's okay. It just means that there's no what's referred to as injury current showing up. So I wasn't having a STEMI. And back to the waiting room I went with a really high blood pressure. And about 15 minutes later, they brought me back where I sat in a chair for blood work. That took another 15 minutes. And then back to the waiting room because there were no beds to put me in, and I wasn't dying in front of them. So that was the triage for the day. Somewhere along the way, I came back and talked to a doctor. And I'm sure the doctor's looking at me thinking, he looks pretty good. He's got chest pain. It's a little concerning, the pain, and I'm now 65. Just turned 65 in November, got my Medicare card. So that's when all hell breaks loose, right? So one of the standard blood tests they do is for a heart enzyme that is very specific to the heart. In other words, nothing, in general, nothing else causes it to be elevated unless there's some heart muscle cells that have been damaged and released into the bloodstream, and that's measurable. It's a very sophisticated test. And so my numbers were not normal. They weren't severely high at all, but I still knew what I needed. I had plenty of time to sit there and figure out the right thing to do for me, and I knew that I needed a cardiac catheterization. So anyway, it came back positive, or the test came back saying, okay, we need to go to the next level. The ER doc consulted a cardiologist. They ordered a heparin drip. In lay terms, it's a blood thinner. Even though it does not change the viscosity of the blood, we refer to them as blood thinners. So at that time, maybe I'd been there 2 hours, about 2 hours. They put an IV in me. They got a drip started and I got a chair. Later I learned that they refer to this area as the vertical care unit because there's no beds in this area. Everybody that's in this area is upright, either standing or in a chair. Time goes on and then I hear, well, you're going to be admitted. I'm thinking, I know that. The heparin drip buys me an admission. They were talking about various next tests. And of course, I'm thinking, yeah, you can say all you want, but I know I need a cardiac cath. Pretty smart about some things. Maybe about 6 hours after I've been there, I get moved to a nice room and bed in the heart hospital. Here I am at the observation deck at Brownsville. And it is a nice January day. Not terribly cold. Like I said, I think the temperature's about probably maybe 46, maybe 47. So I'm there. I know what I need. I'm feeling okay. I was having no pain. Nurses did their thing. So I spent the night there. I was kept NPO, nothing by mouth, after midnight, expecting a cath the next day. I went to the cath lab at 3 p.m. They're slick. I bet there were 6 people in there, and they just sort of descend on you to get all the things situated, all the pads, all the stickers, all the right position, checking IVs, checking me, checking everything, and they're just give me some drugs. I was awake the whole time. I had 3 milligrams of Versed total and 150 micrograms of fentanyl total, and I never closed an eye or slept, because that was there's a certain amount of stress, even though I was finding my breath, finding my calm spot, and just giving myself up to the team to do the right thing, and finding peace in the place where I was, which worked well. The cardiologist was excellent. He told me what I needed to hear. First, a catheter through my right radial artery, which is standard these days. The femoral approach is second choice. So right in the right radial artery, snake a wire up into my heart. And I was watching on the fluoroscopy images a wire in my heart touching my heart and causing VTAC or some kind of fast tachycardia, knowing that this is normal. Not long after that, he was up in the arteries. The first thing they looked at was okay, and then the next squirt in a different place showed dun dun dun. He pointed it out to me. He said, "If you can just turn your head." I said, "Yeah, I can see the screen." And it didn't take me long. I've looked at plenty of pictures of arteries in the heart. And it was about as close to 100 as you can get without total occlusion. He later described it as 95% occluded. Left anterior descending artery. In slang terms, that's the widowmaker. And so I was happy. I was like, there it is. It's fixable. So they fixed it. He stuck a fancy schmancy drug-eluting stent with, I think, had chrome on it and some other things. And I quit. At that point, I was just like, okay, there's really nothing to see. I saw the most exciting part of the procedure, in my opinion. So the cardiac catheterization was Thursday. I spent another night hanging out, adjusting some blood pressure medicines, and treating a little diabetes. Oh, by the way, I'm not even gonna get into that. Hung out. I got clearance. Yeah, you can drive home. You're fixed. There's nothing wrong with you, essentially. Before you had this cath, you could have dropped dead, but now you're good. So I drove home yesterday. And here I am, Saturday. Cardiologist said, do whatever you want. You're fixed. So I'm out on a 3-mile walk. I can go over things that people shouldn't do. So they shouldn't do what I did. It's risky, a little bit foolish. My decisions were made on being hard-headed and a knucklehead, I'm a self-described knucklehead when it comes to certain things. And in fact, not long, I'm losing track of time, but a couple months ago this fall, before it got cold, I got a bee sting in the yard and was having anaphylaxis, and drove myself to the hospital on the Eastern Shore, about 25 minutes away. So yeah, I've got a long history of being a self-diagnosing and treating and doing knucklehead things that I would never feel comfortable telling anybody to do what I would do, what I have done. So I've had plenty of time to think about what happened to me. And of course, so obviously over the years I had developed coronary artery disease. Most people that have coronary artery disease don't know they have it, especially in the younger crowd who've never had any event that has led to testing. And most people, when they have their first event of whatever, don't know that they have anything significant. So over the years, the arteries have narrowed some, especially that left anterior descending, the widowmaker. Clearly, it wasn't 95% occluded over the last weekend. But had it decided to do the nasty last weekend, it could have been a way different story. I could have been 5 miles from help. I could have been up in the hills in an area where I couldn't walk out of. Potential for collapse in extremely cold temperatures, and of course it was a cold hike and I was generating heat by walking. And even if I couldn't walk anymore and put all the clothes on that I had with me in my pack, in a diminished health state, I could have easily not only been dealing with the cardiac consequences, but hypothermia. I get another chance, I've dodged another bullet. I've dodged 2 bullets this year. The anaphylaxis from a bee sting, which was, I think, less close than this cardiac event. So you might ask, well, what happens to coronary arteries? What is a heart attack? So the blood vessel is diseased. It is getting narrowed. So let's say a blood vessel has narrowed and it has 20% narrowing. That means it's 80% open. That's still good. I mean, your blood's going through just fine in a way. But let's say there was 20, maybe 30% narrowing. We'll call that plaque. Plaque is building up. Schmutz. Things that shouldn't be inside arteries, but that most Americans my age have some component of schmutz in their arteries. And you know who you are. Or maybe you don't. Call me. So somewhere along the way, inflammation, stress, strain, changes in the cellular structure of that plaque causes a disruption. Literally now a chunk of plaque lifts up from the vessel. Doesn't have to go very far, it might just lift up. And now it exposes cellular components underneath the plaque that other things in our blood sense and say, well, this is wrong. So let's say, for a really oversimplified thing, you have a plaque disruption, exposure of foreign substances that things like platelets and other chemicals don't like. They start a reaction. Let's say platelets clump up around that because they want to maybe fix this plaque rupture, and it clogs the artery off. No flow downstream from that artery, and the heart muscle downstream says, I can't breathe. You're cutting off my oxygen. I'm dying. I don't like this. And then chemical changes happen and send messages across nerves that go to the brain and say, my chest is hurting. The chest itself isn't hurting. It's the heart muscle. In fact, people with left arm pain, there's nothing wrong with the arm. Nerve messages get crossed on the way to the brain, cross over arm nerves. The message gets passed on to the arm nerve, and when it gets to the brain, it tells the brain, your left arm is suffering, it's hurting. But there's nothing wrong with the left arm. I did not have left arm pain. So I was waiting. I had unhealthy coronary arteries, or at least one, that were waiting to have something happen. It happened due to what? Maybe it was the weekend. Maybe the stress, because I was physically stressed more than I usually, way more actually, in retrospect, physically stressed way more than my normal walks on the Eastern Shore. Let me just stop and assess myself. There's all kinds of birds around here right now. They're little birds, you won't see anything, but I just want to share the beautiful sky. Now, if you've stuck around this far, I want to tell a little story about Friday before I went away to the mountains. I was attending my morning meditation group, my morning Sangha. Some of the discussions was about health issues and injuries, and you know, we're not a particularly young group, although there are some young people, but some of our sharing, we share our joys and our sorrows and our sadness and our traumas, and share what's happening in our life. And so inevitably, you know, we have health problems, and so talk of injuries came up. And so one of the last things I said that Friday morning was, so I'm going off camping and hiking in the mountains, and I certainly could have an injury. I'll let you know. I think those were my words. Close enough. So it's very likely that, although I didn't sprain an ankle or twist a knee or fall and hit my head or injure anything like that, I can't help but think that there was enough stress that caused, at least the beginning, set in motion this final pathway of a heart attack where plaque gets disrupted, exposed, platelets and other schmutz builds up and causes an acute 95% narrowing. That's what I think happened. We talk about impermanence and how nothing stays the same. If you are enjoying good health, it cannot last. It will not last. If you are enjoying or not enjoying bad health, it too won't last. Now, worst case scenario, your bad health could continue to the final breath, which is completely normal in life, because there will come a day for all of us where there will be a final breath, regardless of what you believe. So I wanted to finish this up with a thank you to friends and family who stuck to the end, who are actually watching this. And I understand if you didn't make it. Anyway, life is real. Don't take anything for granted. Things are going to happen. Start working now to be able to cope with whatever's going to happen. Enjoy the moment. Live in the present moment. And I'll probably have another story pretty soon. I just have that feeling, and that's just fine. Till next time. Bye-bye.